Thank you, organizers. Many of you are my close friends, so I'm happy to see all of you again. My seniors are also here in the audience. I'm so glad to be here to be able to speak in front of you about another new topic I have selected for presentation. This is about environmental causes for diabetes. So the first thing, most of us speak about obesity. So this morning you have heard so much about obesity. I'm not going to talk too much about in detail about the molecular mechanisms, but I just want to emphasize that there have been several obesity figures circulating in the literature which do not really reflect what is the situation. All of us for 40 years have been working doing a lot of work with ICMR, RSSDI, making so much of data on obesity. But here you can see this is all Government of India data. Government of India in NFHS in about few years back, they have published that Hyderabad has got highest number of obese people in India. I'm not very sure. I don't know where is the data from. I am not involved in that. Then they also mentioned that undernutrition is also very common in Hyderabadi men. You can see there in Hyderabad, men and women have about almost 12-20% of them undernourished. That means undernourishment as well as overnutrition are prevalent mostly in Hyderabadi people. So, okay, fine. Then the next, after a few years, they have brought out NFHS 5. So you can see NFHS 5, they are written there that obesity is more common in urban areas and women of Tamil Nadu. Not Hyderabad is nowhere, so Hyderabad is gone. So they are comparing Tamil Nadu with other cities and showing that it is more common in. Anyway, just look at the figures. If you can see the small figures, 40% of urban men and women in Tamil Nadu are, to be more accurate, in Madras are obese. 40% above 25 BMI in Madras. Okay, fine. Then only 11% of them are diabetics. That means is diabetes not related to obesity, or are we going to, this is between 15 to 49 years age group. So there is some lot of discordance between these numbers. If you look at this other number, this is also from NFH5. So you can see only 5% of people in India have BMI more than 25. But 14% of them have glucose intolerance. That means where are these people coming from? Are they related to some other risk factor? So I just tried to look at other risk factors described in literature for diabetes. If this is true, if there is a difference in the prevalence of obesity and unrelated to diabetes, let us see what are the other environmental factors described in Indian literature mostly. So these are all the known risk factors. You all know family history of diabetes, obesity, physical inactivity, hypertension, fats, then pregnancy, age above 40 years, then easily digestible carbohydrates. Then we go to the lesser known risk factors. So I was sort of surprised to see this data about air pollution. Last 4 or 5 years we have been seeing so much of data on air pollution related to diabetes, morbidity and mortality also. This is the global burden of diseases. So South Asia has highest air pollution related to diabetes. Air pollution, previously it was COPD, but now they're all trying to focus diabetes and cardiovascular disease and obesity have a direct association with the air pollution. So this, you can see Vijayakumar 2019 from Madras city. He has also published that particular size of the PM 2.5. So people who are exposed to PM 2.5 seem to be more affected with diabetes from Madras city, Vijayakumar. Those two pie graphs are global burden of disease, South Asian data, which I have shown in the previous slide. If you look at this particular left side of this slide, you can see if there are about 650,000 people dying of diabetes each year in India, 50,000 people of them are dying of diabetes related to air pollution. So it's a large number. So I was not aware of this kind of numbers, but it seems this is our government of India as well as international data. So 22% of the deaths, 22% of diabetic deaths in India are directly attributed to air pollution. Death, I'm talking about mortality. So it's a very serious issue. I didn't know about it. So they have given so many explanations like burning that crop wastages, or even our Diwali is also blamed. And there are a lot of transport fuels. So many things have been attributed. This is from Indian data. So it seems air pollution is causing a lot of diabetes morbidity as well as mortality in India. Then I will go to the noise pollution. I'm not aware that Muzaffarpur, Moradabad in UP, there are UP people. These are all not publications, there are news items from, but they are accepted. It seems Moradabad has highest noise pollution in the world, not in India, in the world, it seems. I'm not very sure. But anyway, we have this paper, next paper, you can see this is a very important paper in about 3 lakh population. They have shown that people who are exposed to 60 decibels and in a follow-up period of 6.2 years, they have found out that these young people living alone, white-collar jobs, have a higher education levels, they're physically very active, they consume less red meat, but still they have normal weight, still they have more diabetes, just attributed to that 60 decibels of road traffic noise over a period of 6.2. It's a mean follow-up period. So it seems noise pollution is also something very bad in India. We have to, this is a description how noise pollution could affect glucose tolerance. Then I will talk about light pollution. So this paper is also a very important paper from China. It's almost like 100,000 population from 162 study sites, and they have shown that outdoor light, especially people working in the nights, they also seem to have a lot of diabetes. So this is also published in Diabetologia. So it's an authentic publication. So recently it was published. So light pollution. Then plastic. Everybody knows about plastic. I'm not going to talk too much about plastics, but you all know that plastic in the weather is actually related to subacute thyroiditis in living people, or women in pregnancy exposed to plastic, are delivering babies with thyroid and diabetes. So they're all known to us. So plastic is there everywhere. Just to give you some ideas about bisphenol. Bisphenol is a lining, plastic lining, and all the cups what we are drinking from. Then microplastics and nanoplastics are the broken plastic material in our blood. In our blood, urine and feces, they are like 5 millimeters and 0.01. They are seen in the blood, in human blood, in all our Indian samples. So that is another risk factor. Then I'll talk to you about radioactivity. In 2011, there was a radioactive incident in Japan, and then they have put about 123 male workers in decontamination, and out of them about 11% of them were diabetic compared to the 7% in normal population. And after 3 years, during the decontamination, as well as in those people who were also exposed to this radioactivity, you can see here the incidence rates, annual incidence rates of newly developed diabetes is about 3 per person years compared to 1.4 in normal population in Japan. But anyway, in India we have this data, and most of the installations, nuclear installations in India do not emit more than 5 millisieverts, it seems. So anything more than 5 millisieverts or more than 10 millisievert radiation is supposed to be causing diabetes in other populations. So India, we don't have much data about this particular thing. Then these particular vessels which we use every day. So PFAS are called forever and everywhere. Forever and everywhere. They are everywhere. You can't. They are not destroyable. They don't become. They cannot be excreted in urine or feces. So they are there everywhere. In whatever material you are using outside for anything, it is there. Especially non-stick pans and so many other things. So it all cause diabetes. And heavy metals. So you can see here we are all pushing all our heavy metal material into drainage, and this is the Indian data. The contribution of heavy metals in our drinking water through the pollution is this, and I have also done a small study. So this is done by a chemistry department. So you can see all these heavy metals are in large quantities, both in nails and hair. So you can see it here. They are almost like 10 times, 100 times more than the normal limits. This is from Hyderabad. This is local data. So they are all diabetogenic. So we are all exposed to that kind of heavy metals through our water. Organophosphorus. All of you know everything about organophosphorus. This is from Tamil Nadu. Tamil Nadu with French collaboration with the United States, universities from United States, 2 universities from United States, 2 universities from France. So they collaborated in this large study, and they have found out that this is not new or unique to this population. I'm just showing you this slide to give you the importance of pesticides. So people exposed to the pesticides, especially organophosphorus, they have diabetes almost like 308 versus 86. Almost like 4 times more diabetes than people who are not exposed. Then I will go to organochlorides. This is S.V. Madhu's data from GTB hospital from Delhi. So he has seen that people who are exposed to organochlorides, it seems in Trans-Yamuna area, organochlorides are mostly seen in drinking water. So he also gets patients from different areas of the country. So he has compared those people coming from these areas exposed to organochlorides, and I found out that you can see here 38% and 42% of this population had glucose intolerance compared to only 20% who are normal. So the organochlorides are also implicated in diabetogenesis. Then sleep. Of course, we are trying to make some data out of it, but mostly about 100,000 children, sorry, not children, but 100,000 young adults, they don't sleep in the night because they're all working in software industry in Hyderabad, more than 100,000. So most of them are having some sort of glucose intolerance because they're all about 25 years age group. So we are making out some data, but this is also proved. Now this is a data from Korea, is recently published. So anybody is sleeping less than 5 hours in the night is also prone for developing diabetes, and it is proved. There was some discussion about autoimmunity and inflammation. So you heard so much about inflammation. Diabetes causes inflammation. Inflammation causes diabetes. There are so many ways by which inflammation can cause diabetes. So diabetes is a inflammatory disease. All of you know about it. So we also done about 7 antibodies in type 2 diabetes and found that 19% of type 2 diabetes at different stages of natural progression have antibodies, halogen antibody, insulin antibody, GAD antibody, tissue transglutaminase, and 2 thyroid antibodies. So this is a very common, 19% in type 2 diabetes have antibodies. So autoimmunity is not unique to type 1. So autoimmunity may also be seen in type 2. Then gut. People talk so much about gut. I'm just going fast about these 3 slides. Gut, of course, you know, the gut microbiome weighs about 2 kilos. Every human being is carrying about 2 kilos of gut microbiome. And gut microbiome has a lot of benefits as well as disadvantages, especially the leaky gut syndrome. So you all heard about leaky gut syndrome for various reasons. Like Western diet, antibiotics, alcohol, circadian rhythm disruption, psychological stress, and aging, the gut barrier may be disrupted. So that causes leaky gut syndrome. Nowadays our gastroenterology friends are working so much about, and they're talking so much about leaky gut syndrome, and they're attributing every disease, diabetes, hypertension, Parkinsonism, Alzheimer's, cancer, everything to leaky gut syndrome. It seems all the material what you are eating is leaking into the portal circulation and directly going to the liver or going into the systemic circulation and causing all sorts of autoimmunities. So this is something which is alarming. In future, all of us have to look at our leaky gut syndrome cases. And then, of course, there are also nice things written about diet, physical activity, and anti-diabetic drugs being useful through facilitating this gut microbiome functions for managing diabetes. So it's nice that gut microbiome is also helping us through our own diet, physical activity, and anti-diabetic drugs in making diabetes life easier for our patients. Then lastly, I'll talk to you about low protein diet. Low protein diet is very common in India. It seems Indians take only 12% as proteins, it seems. Most of us are supposed to take 15% as protein. So we talk so much about carbohydrate, we talk so much about fat, but it seems this is a mathematical modeling done by our own Madras people. Anjana has published it. So it's an ICMR publication. Last year, end of the last year they have published. And they have shown that by increasing the protein content, you can actually facilitate diabetes remission in already diagnosed diabetes. You can also prevent diabetes in people who are not diabetic. This is a mathematical modeling based on a large ICMR INDIAB data, very large ICMR INDIAB data. So what was new to me from this data was that we have to take at least 20% as protein. I am taking only 12% as my protein. So my dietitians, my friends tell me that I should eat more. But it is so difficult to eat protein. I don't eat any of those things. So eating protein is a very difficult thing. So it seems because we are eating less protein, there was some talk about sarcopenia, there was talk about muscle loss, there was talk about something else, replacing the protein in the muscle. So all these things may be sorted out by eating more protein. I'm not very sure how to eat more protein. Protein is not there except in meats. Many of us don't eat meat. Or egg has only 7 grams protein, so it's a very small amount of protein. So it's very difficult to make people to eat more protein. Actually, looking at the 20% requirement in a person who is taking about 1500 to 2000 calories, you have to eat anywhere between 50 to 70 grams of protein, 50 to 70 grams. I'm eating only 25 to 40 grams, but you have to eat 50 to 70 grams. If you don't eat that kind of protein, you may be prone to develop diabetes by this mathematical modeling paper published by ICMR INDIAB study last year. So these are all the different environmental reasons why we are getting diabetes, apart from the known causes like obesity and other things. Thank you.